Okay, here we're going to look at some proprioception in the research. Proprioceptors detect the amount of stretch or tension in skeletal muscle, in the tendons, and in the joints. They send information to the brain so that the proper adjustment can be made to maintain balance and maintain posture. These proprioceptors are constantly telling our brain of where we are in space, our movements, joint awareness, and so on. Okay, Punjabi, a well-known researcher, mentions that joints, ligaments, muscle belly, they all have receptors for neural control to determine spinal stability. Okay, so to keep our spine stable, our joints, ligaments, and muscle bellies are going to help through the nervous system determine the spinal stability. So a faulty motor control can cause signals to fire too much or too little, causing spinal instability. Okay, so this means hyper or hypoactive nerve signaling. Okay, that can cause spine instability. This neural control loss can become chronic, and when that happens, there are going to be changes in neuromotor control, and that control can become altered and worse over time. The altered mechanoreception, which is, so you have your mechanoreceptors and your proprioceptors, and this one's from McLean Spine Journal. So altered mechanoreception has a direct effect on reflex activity of muscles crossing a joint. Okay, and the kind of work that I do with adjustments and dry needling and rehab, all that, this actually corrects the disturbance in the joint, and that disturbance, as the patient's coming in, they're experiencing joint dysfunction. The elite athletes or people that are very active and really understand their body, they'll just tell me something's not working quite right, my knee doesn't feel right, my ankle doesn't feel right, or a baseball player, my shoulder, my throwing motion just doesn't feel right, the swimmer, my stroke just doesn't feel right. Well, they're experiencing joint dysfunction, which is bombarding the brain with abnormal proprioception, which is sending a motor feedback of abnormalities. This joint deafferentation, and this can accelerate degenerative changes. So degeneration can begin to set in when a joint is not behaving normally. So the disturbance in the articular innervation may play a role in the development of degeneration, inflammatory disease, and joint dysfunction. And this is painful. And this is the stuff I deal with all day long. People that are coming in with disturbances in their joints. In fancy terms, in the articular innervation and joint dysfunction. And so when we correct that, function comes back. Afferent, efferent input becomes normalized again. Proprioception and balance improves. And then they go back to their performance, whatever the sport may be, and they can feel a difference. Now, you don't have to be an athlete to experience this. You can be a ap, not really that active. You have a desk job and just your daily activities and things like that. They get hurt too. They have low back pain and headaches and wrist pain and so forth. And but it's the same thing. They have deafferentation, and they're in the phases of getting degenerative changes, and the joint hurts, and there's inflammation and joint dysfunction, and we correct that. And once it's corrected, there's a dramatic improvement. They feel better, they function better. Out of this journal, the joint capsule proprioception, they connect with the gamma motor neuron, and can alter the sensitivity of muscle spindles and muscle tone. Changes in capsular pressure, like joint swelling or inflammation, tension, like muscle spasms, or the integrity, which means there could be a tear there, create aberrant or abnormal signals which can lead to inappropriate increases in muscle tone and restriction of motion. Translation, this is your muscle spasm. And by gapping the joint, which is the adjustment, by a controlled specific manipulation, this will induce a sudden burst of capsular afferent activity which cause a reflex decrease in muscle tone, so the spasm starts to reduce. Now, I've added the dry needling to my techniques, which reduces it even more, so the person gets better quicker. So once you have calmed down the muscle tone and the muscle spasm, and this will allow for increase in joint movement. So if you're an athlete, if you're an active person, this is a good thing. You get your fastball, the miles per hour improves, or it comes back to where it was. You tend to, you swim faster, you run faster. So all the stuff that was creating dysfunction has now been removed. So function comes back. So your performance goes up. And this will allow the muscle to relax because the adjustment is stimulating the Golgi tendon receptors to inhibit the alpha motor neurons. So by inhibiting them, we're calming down the spasm information. So we are reducing the spasm. Okay, the large myelinated fibers, which are mechanoreceptors, if these are stimulating, meaning adjusted or manipulated, the normal balance of activity between the large mechanoreceptive fibers and the small nociceptive fibers would be restored and pain would be relieved. In other words, if a person is coming in pain because of spasms, joint dysfunction, inflammation, and so forth, if you can increase proprioception, you will decrease nociception. Okay, nociception is your pain fibers. So if you increase proprioception, you decrease nociception. And that's why you get pain relief.